Welcome, everyone, to Skin Goals Podcast. I'm your host, Lisa Avalos, and this is my co-host, Kelly.
Hey, all, and welcome to the podcast, to Skin Goals today. Today, we have a fabulous guest with us. Really, pharmacist to the stars, pharmacist to the world. Dr. Ethan Melillo is with us, and we're going to get into the pharmacy today.
Awesome. Thank you for having me.
Yeah, you ready to do it?
Oh, I'm excited.
We're excited to have you here. So excited. I think like the biggest part is like, we call this like ask your pharmacist, right?
Yeah.
I'm always at a pharmacy, getting older, guys. But it's just a fascinating world, and we're excited to deep dive on pharmacy and beauty today.
Yeah.
Yes, absolutely. All right. So pharmacy. Okay. I love how you like more and more going to the pharmacist, right? Talking to your pharmacist. Okay. I have always been a little scared of my pharmacist because I'm intimidated.
We're not that scary.
You're so smart. Like, and so like when I get like, you know, a retinol prescription filled or something filled, like I know that says like you can consult with your pharmacist, and I'm like, what would I ask? What would I say? Like, what questions? Like, I kind of get like in my head about it a little bit. And so I love that you're here, Ethan, to kind of like help demystify, like, you know, even from a skincare perspective, what could we be talking to our pharmacists about? Yeah. What type of questions and all that? Because you can be best friends with your pharmacist.
Yes, you can.
Pharmacy besties.
Pharmacy besties.
But before we get started, Ethan, tell us about your background.
Yeah, sure. So for me, I graduated from the University of Rhode Island back in like 2017. So I've been a pharmacist for 7 years now. And so I've worked in community pharmacy for about 12 years. I started off as like a cashier up front, made my way as a technician, worked as a student, then as a resident, and then as a pharmacist. So I've been in like the community pharmacy world for a long time. And now I'm here at L'Oreal working with brands CeraVe and La Roche-Posay to really help educate pharmacists, technicians, and students about skincare.
Oh my gosh, that is such a cool journey because Lisa and I also have a similar like behind the counter journey, like coming from like, and it's so cool when
I mean, we didn't end up doctors or anything. Similar journey, same, right?
Same.
Same.
It's
Yeah,
exact same. Like,
Yeah.
you know, exact same. Minus the DR, you know, like, you know, but I love that. Like you literally have had different stages and have seen it from different perspectives, right? Have you ever seen someone who is a little nervous to talk to the pharmacist?
Yeah, no, definitely. It can be nerve-wracking, especially because it's, you know, it's personal information that you're sharing. You're nervous, like, oh, this person behind me listening, like what I'm talking about with the pharmacist.
Yeah.
So it could definitely be kind of nerve-wracking, but it's really like the opportunity that you have to like talk one-on-one with a healthcare professional that you may not get when you're going to maybe like a doctor's office, for example, if like they're really busy, you know. I'm sure if you've been recently, like it can be kind of crazy to get in.
Or sometimes you have an emergency, like, oh my gosh, I just got this crazy sunburn and I need help.
Yeah.
You know, my doctor might be closed right now.
Yeah, and you can just go to your pharmacies. There's 24-hour pharmacies. You just hop right in, ask a question.
Mm-hmm. Well, I love this because I mean, just like, and I know I have the capability of like hanging out with my pharmacist because my parents do. My parents are like best friends with Ben, their pharmacist. And they're always like, oh, Ben said this or Ben said that. And I'm just like, oh, I should have a relationship with my pharmacist. I should be asking, you know, the questions. So like why, like, how can we make our pharmacists kind of like our skincare ally?
Yeah, definitely. So again, the one thing that a lot of people don't realize is that pharmacists, we are the most accessible like healthcare provider. So it doesn't cost a copay to ask your pharmacist a question. So we're very easy to talk to too. I know sometimes, you know, we may be in the back looking like really busy, but if you grab us, that's why we went into pharmacy, is to really help people. So especially when you're going down the skincare aisle, it can be very, you know, I feel like there's overwhelming. I feel like the best word for that. And so your pharmacist is there to kind of guide you and assist you. Like if there's something specific that you need, or if there's a concern that you have, you can ask your pharmacist. And again, no copay to ask that question.
Yeah, that skincare aisle, I'll say, boxes everywhere, right? There's so many products out, and like I get puzzled by it sometimes on different ingredients, how to use it. Like, you know what I mean? Sometimes I need advice, like great healthcare advice, skincare advice, and that's a perfect place to get it.
Yeah. There's why didn't I ever think of this? now I'm like so in.
Yeah.
So what are some of like the typical questions you get about skincare from your customers?
Sure. So you definitely get like I want to get a cleanser, but I want something that's not going to dry me out, or what's like the best sunscreen for my skin? Or, I'm on a medication, like, is this gonna make me more sensitive to the sun? So there's things like that, especially when talking about prescription medications, that is a concern a lot of patients talk about.
Absolutely. Absolutely. Did you ever get a question that you're like, oh my God, I totally helped that person? Like, and you're like, yes. Like,
oh yeah, definitely. That's one of the best things. And that's why I love like working when I was working in the community setting, is that, there's people who like, they just don't know, or like they're relying on like a Google search or something like that in order to help. And so you're able to really, guide them to pick the best product for them. And then there are times, as pharmacists, like if we don't know everything. So I always like to say that like, we're not a know all be all kind of healthcare professional. And we know when, if something needs to be seen by like a derm or another provider, we're very easy to, be like, hey, I think it's best that you see a dermatologist for this, or another provider.
Amazing. Like expertise, like there's different, layers. Like you're not like the genie from Aladdin who's like all knowing and all like, powerful. Make me the most powerful pharmacist in the world.
I wish, but
but still, like there's some real expertise, like and knowledge sharing there. That's amazing. Love it.
Great. So this is a great and perfect segue for us to take a quick break. We'll be right back. And we're back.
Hey everyone. So back with Ethan. And Ethan, we've been talking a lot about like generalized skincare, but like what about like specific concerns like acne or eczema or like dry skin? Like can pharmacists help with those as well?
Yeah, definitely, especially with like acne, eczema, and dry skin. And with these, like skin conditions, they need what's like known as like adjunctive therapy. So it's kind of like a cleanser, a moisturizer. And so your pharmacist is a great resource to use to say, hey, what's the best cleanser for me? I have acne. What should I be using? What's like a simple cleanser or simple moisturizer for me to use for this? And so that's why it really plays such a huge role. And then they can be able to, point you in the right direction. Or if you have allergies to certain specifics of like ingredients in some of the products, they can help you out with that as well.
Amazing. So like if it's like, something that you're using could be drying to treat, but like a moisturizer is going to make it feel a little better potentially.
Yeah, definitely. Yeah. And that's the thing with a lot of prescription medications. So for example, with acne, there's sometimes a lot of poor adherence. So a lot of people may not, keep continuing with their regimen because of like, it may cause really drying, and they don't have an adjunctive skincare like regimen, like with a nice, like a simple cleanser, a simple moisturizer. And by incorporating in that, it helps people actually continue on with their acne regimen.
That makes so much sense. Yeah. Cause some people stop in their journey because they might be getting a side effect that is like maybe hurting their skin or causing irritation.
Yeah, extreme dryness too is like a huge thing. And so, that's
but to keep them on their medication or their skincare routine, it's like asking that pharmacist on what other type of like moisturizer, for example, that they can use to help.
Exactly.
Just like you'd ask your best friend, you can ask your best friend pharmacist.
Yes, definitely. That's why we're there.
So talking about that, are there any skincare ingredients that people should use with caution?
Yeah, so definitely, a lot of like that different active ingredients. So especially when it comes to some cleansers, some toners, some moisturizers, if you're adding it on, if you're having irritation, you want to talk to your pharmacist, let them know, hey, I'm taking A, B, C, and D, and they'll maybe be able to tell you, hey, maybe use this like every other day to kind of reduce that irritation, or maybe like, let's just take this away. You may not need it. The other thing too, that's a huge thing that I feel like I actually learned this from an allergist was, looking at on the bottle when it says like fragrance free. So a lot of people they're like, I can't use something with fragrances. So they'll see like fragrance free, which that's great. You want to grab something like that. But then there's also unscented, which can be really confusing to like a patient or a consumer who's trying to not use something with fragrance, because in those unscented, there's still fragrances in it that can actually cause skin irritations.
That makes so much sense.
How interesting. Yeah. Oh my gosh. Yeah. There's so many there's so many things that like your pharmacist can help tip you off too.
Exactly. Yeah.
Right. Yeah. Yeah. Like because there's so much in the aisle when you're in the drugstore, absolutely.
Oh yeah, and it's hard to see like with the fragrance free or like unscented, like they try to hide it sometimes for you.
Yeah, yeah, it's so true. Okay, so speaking of like, being in the pharmacy or being back in the pharmacy, is there anything that you really miss about your days when you were pharmacist?
Yeah, so it definitely is the patients. So I feel like the reason people go into pharmacy is they want to help people. And so when I was in a community pharmacy and I was at the pharmacy for about 5 years as like a pharmacist, and you have a bond with, like, you have like your own community with, your patients. And so you know them by name, if like someone hasn't shown up in like a week or so, you can call them, say, hey, like what's going on? Like, is everything okay? And so you really start to build like a really like personal bond with them.
Oh, I feel like I would miss that too. Yeah. Like it's all about connection for me. You
got to talk to your pharmacist. That's the main thing. You got to build that relationship.
Don't be afraid of them, Kelly.
Yes, don't be afraid of us.
I'm literally like, I'm now so curious. I'm like, exploring and just being like, okay, like tell me what you know.
Especially even like just cost savings as well. That's a huge thing that patients don't realize, that some over-the-counter medications, they could be, if it's written as a prescription, it could possibly be covered by their insurance as well. And a lot of people don't realize that. So there's little tips that pharmacists can help show you.
Yeah. Isn't there a way you can purchase sunscreen like that too?
Exactly. Yes. Yep. Your doctor could write you a prescription. They could fill it, or whether you're using like an FSA, HSA as well, because it's something that you're putting in pre-tax, that can really help, save on costs too.
I love it. And we're going to go into a whole little episode on sun next with Ethan. Keep listening, keep watching. Yes. Like there's a whole lot more to explore there. So.
Yeah. So talking about your experiences at the pharmacy, also this is a beauty podcast and we like to deep dive on different segments of beauty and careers. How are you liking your time at L'Oreal? Are you learning so much? What is your favorite part?
It's amazing. I tell everyone this is like the dream job. Like it's still helping people because it's on the other side of things where, I'm helping, bring more awareness and education about skin health. And I think that it's something that, pharmacists know. They know how to counsel patients on over-the-counter ingredients, but it's something that they may not realize, like, when a patient's getting a prescription, they're just going through the hustle and bustle of things, and they could be like, hey, I could maybe stop and actually, talk about it. If it's like, for example, an acne medication that may cause dryness, maybe this is where I can, may have an opportunity with the patient to talk to them. Are they using a simple cleanser? Are they using a simple moisturizer? Things like that.
Mm-hmm. Yeah, absolutely. When you were saying, you were like, I really miss helping people. Like I was just thinking, I'm like, well, like you're also like TikTok, pharmacist to the world. So like you're still helping so many people, but also helping by being really a resource for skin goals too. Yep. So we're so grateful.
And an advocate for like pharmacists.
Yeah. So and thank you guys so much for having me. It's a great time with y'all.
Yeah.
So this has been fascinating. And I am feeling really so much more comfortable, like going and chatting with my pharmacist, becoming best friends. I'm going to seek out Ben. But Lisa, like what are the learns? Like what are you taking away from this episode today?
I think the biggest learn for me is that I have an open access to a medical professional when I'm in need. Like I don't have to go pay a copay if I have a simple question. And a lot of times my questions are pretty simple. I just want confirmation, Yeah. How about you, Cal?
I feel like honestly, that is like I hate when I like bite someone else's thing. Like I'm like, oh, like that's mine too. But like that's mine too. Like I think I wasn't looking at it in the way of like just available resource, someone to confirm or help me through like
a symptom. Because sometimes I do get dry and I'm like, what am I doing wrong? Or maybe I just need to ask somebody, tag somebody in, right?
Yeah.
On their expertise.
Absolutely. I'm ready. I want to leave here right now and walk over to a pharmacy and walk right back to that counter and be like, hi, I have something to consult with you on.
And they'll be excited to see you. So.
I love it.
Oh, well, thank you so much, Ethan, for being here with us. And thank you, everybody, for joining us on Skin Goals. Till next time.